Hi, my name's Ryan. I'd like to talk to you. Um, I'm first. I'll apologize for some of the decoration in the backgrounds. In the background here. I'm a minimalist, a radical minimalist, but my roommate is not. So like me, I'm happy with just a bed and a comfy chair and a desk and table and whatever I need to live. Basic stuff. My roommate, you know, she keeps everything. I read a book, I give it away. She reads a book, she hangs on to it for the next 20, 30 years. So, and it's okay. We're just very different, but we get along, so that's good. So I always feel a little self-conscious when there's lots of stuff in the background, but because if it was just my place, it wouldn't be that way. But she also would probably feel very uncomfortable if I overtook and I didn't have anything here. So, and she would probably apologize for that. Humans are individual, and that's okay. I am wanting to talk to you because I am really struggling right now, and I've been struggling for a long time. A big thing about this, a big struggle that I have, is my self confidence. I've lost almost 100 pounds in the last year, and I feel really good about that. I also have been getting my teeth fixed. I've had a number of extractions. I'm waiting for a new denture right now up top, so I look a little funny, but that's okay. Uh, but for many years, I worked in mental health and was always learning and taking on new educational endeavors. I've studied social work, psychology, paramedicine. I've studied a little bit of respiratory therapy. I didn't go very far with that, but I'm always picking something. And creative writing is something I did for a little while, and emergency social services, disaster management. There's always been a course I've been taking somewhere or working on some degree or what have you. I just can't seem to stick with one thing. Same is true for my arts endeavors. I'm a musician and a photographer, a writer. I've worked as a journalist before for a small publication out of Manitoba, and it felt good. I got paid for that. I do public speaking and I do guest lecturing on occasion. I am involved with a research network for mood disorders, in particular bipolar disorder. And I've been involved with them for a few years now, and I'm involved with them because I have bipolar disorder type 2. I also live with complex trauma, and I live with anxiety, an anxiety disorder. This has been a really difficult thing to navigate in life, but I keep trying. I keep going. I keep trying to make the best of my situation. And I generally don't even really like to give people my current face. I don't like to show it these days. I haven't in a long time. I quite often will upload a picture that's a couple years old or something. But I'm trying to break out of my shell. I've had a lot of health scares. Last year I was diagnosed with pulmonary embolism and almost died. I have liver disease. Found out my clots were due to a disorder I have, a rare disorder called antiphospholipid syndrome. It's approximately 4 to 6% of the general population has it. It's like 1 in every 2,000 people or something. So it's classified as rare, and there's not a lot of research on it. There's some. It was only diagnosed or discovered in the 80s, and originally was found in lupus patients, but they also found that people without lupus had this. And so I don't have lupus, but the antibody I have is called a lupus anticoagulant. Um, and so I've been diagnosed with that. And that's okay. I'm learning how to deal with it. There's a lot of symptoms that I get. I am on a blood thinner. I do have high blood pressure now. I have a lot of things going on, and I'm scared. a lot of the time, so that doesn't help my anxiety. And I'm in pain. So I just wanted to, I do live with painful conditions, so I wanted to share a bit of my story. And I'm having anxiety right now, but I'm trying to get through it. So I'm really trying to break out of this and let you guys know that, you know, I do plan on getting back to work full time at some point. I plan on overcoming this. I'm going to keep losing weight. I'm going to get healthier. I'm on long-term opioid therapy. It helps. I don't know if I'm going to get cut off. I hope not. I really, really hope not. I want to get back to doing medical work. I want to get back to doing frontline mental health work. I love, the research angle. I love policy. I love ethics. And these are all things I can continue to do. I got really stressed out by the work that I was doing for so long, and I was working a lot of overtime. It was very intense. Working the drug poisoning crisis. A lot of things that come with that, and the people I've lost. Friends, colleagues, clients. And it's even more angering that the government has stalled on the solutions for that. We all know what they are. It's safe supply. We need more of it. And doctors can prescribe it now. But, it's not the same thing as, as heroin or cocaine or, or benzodiazepines. You can get benzodiazepines, but, we need safe stuff on the street for people. And the more that we have safe supply, the easier it's also going to be for pain patients like myself to get medications. I have lived with problematic alcohol use for many years of my life, and that's not the case for me anymore. I've stopped getting drunk. I haven't been drunk in over a year now, and that's great. I do have 1 to 2 drinks every couple of months. It keeps the cravings at bay, and I don't feel an urge to go and drink because I know that I can if I want to. And that's been really empowering for me. It's not going to be everybody's path, but it's my path, and it is harm reduction. And being treated, having my pain, like my arthritis and various long-standing injuries that I have treated with long-term opioid therapy has also been very helpful for me. Yes, sometimes I get a little sedated, and especially at night when I take 2 pills at night, then I get very sedated, but I go to sleep, and it's actually been really helpful for me in that I can function during the day now. I feel stronger and like I can manage the pain instead of just being in bed all the time. The pandemic has not allowed me to really go out a whole lot. The antiphospholipid syndrome is autoimmune, and it causes clots, heart attacks, strokes, a whole lot of joint pain and stuff. It does a lot to your body. But it's and then I live with hypothyroidism. I just have a lot going on medically. I've got asthma. Currently, right now, my allergies are flaring. I don't know if you can hear it in my voice, but for a few days there, it was really bad. And I have other issues that I'm not going to name on here, other medical issues that just people don't need to know. But, it's a lot of my pain also stems from childhood injuries. I was abused, and I ended up in the foster care system, and then I was homeless when I aged out at 18 in Manitoba. And so my body's taken a beating, and it really hurts now. And so these medications allow me to function and to be, just in a better place in my life. And, for me, that's a win. I'll take that. I'm glad I have it. Because without it, I probably would end up going to the street for stuff. And nobody wants to do that. Nobody wants to see anybody do that. And so this is the safest thing, you know. It's the best solution for me. And you know, I'm just trying to work really hard on myself and be healthy. And it's hard when you're hit with so many different health issues. You know, I just want my health back. And I'm working, like I said, I'm working hard for it. I've lost a bunch of weight. I go for walks almost every day. I'm in therapy. I see my doctor on a regular basis. I'm getting trigger point therapy now, needles in my muscles. You know, I'm trying everything I can and reaching out to my social supports, and I feel good about that. Um, and hopefully, as things open up now, I can start getting more of a social life in, and hopefully get back to some kind of uh, job where I can go and be part of a team. I tried, and that ended up falling through. I don't know what happened on their end, but they told me I was hired, and then we played some phone tag, and the person just wouldn't give me a date that I could start my training. So that was a disappointment because I would have really liked that. Um, and I miss working. And it's been a couple of years now since I've, you know, been in a regular job. You know, so I want to do that for myself. I need to for my mental health. And I'm unfortunately also stuck with anxiety. And so I just wanted to be a little more honest and open about my struggle and why I do all of my work from home and online right now. Why it's, you know, a matter of me doing a whole bunch of consulting over the internet. Why, you know, I'm not in an office. Why I have had such a hard time connecting with network members in person. Sometimes even phone calls are really difficult for me. And so, you know, I'm doing a bit of a medication adjustment right now because I think that, you know, my sleep was off for a while, and I think that might have been a slight hypomania because I also felt a little more motivated, more than I, you know, feel usually, and a little more irritable for a while. So, you know, I'm looking at medication adjustment right now, and hopefully that'll take care of it, so I can get back to doing things with the network and engage on a deeper level than I was able to before. So I do have a lot of hope, and this is just a little bit of my story that I wanted to share, because I think it's really important that people are open about their struggles if they're comfortable with that. You know, and I want to get back into guest lecturing and doing public speaking and engaging on municipal levels and, you know, federal levels if possible, provincial levels, and kind of diving into all of the advocacy that I used to do tirelessly. You know, I do get more tired now, but I'm still here and I still have a flame in me, and I still want to advocate for patient care. I still want to advocate for pain patients. I still want to advocate for safer working conditions for health professionals, be it medical or mental health. Um, you know, I want to advocate for more housing. I want to advocate for higher social assistance rates. You know, I'm glad that, you know, we're going to have better medication coverage for people and dental coverage. There's still so much wrong with society, but I think that, you know, there's still some things that are starting to go right. And, you know, the things that aren't going right, we can all collectively work together and push for that. And I believe that a whole bunch of change is about to happen. There's no way it can't. You know? So, but this is just like a hello from me, and thanks for watching, and thanks for sharing this vulnerable moment with me. I've been having an anxiety attack most of the time through this little video. So my little toothless grin, and on this side anyway, and you know, I hope that you'll continue with me on this journey and keep watching my videos as I get healthier and stronger, and continue fighting the fight. All right. Lots of love.